great to be here. I'm not a technologist. This was, I think, an academic conference that felt more like an Apple launch event than any other I've been to. So it's been really interesting to hear these different perspectives. I love this interdisciplinary nature here. I think I would even count myself as a techno-skeptic, and we can talk more about it later. I'm a social work scholar, first of all, and I'm also an empiricist. And as a social work scholar and an empiricist, I think that to solve a social problem, we need to think about, well, what is the social problem? And if technology is the solution, then it will only be successful if we really understand that problem and how to solve the problem. The problem that I'm going to talk about today is loneliness, and loneliness among older adults aging in place in the US. And so here's my agenda for the presentation. I'll first talk about something that we really care about in social work, which is the social determinants of health, right? We know that there's more to health than taking your medicine, than going on a run, right? There are actually social factors that cause your health, that disrupt your ability to live your overall well-being and your health. We'll do a little short primer on the social determinants of health. Then I'll talk about loneliness as a determinant of health. There's a lot of great research now showing the negative effects of loneliness and social isolation, so I thought I'd just generally do an overview, and then I'll present to you some really original data coming from the Health and Retirement Study. I haven't seen this data presented anywhere else, so it's prevalence of loneliness among older adults. So what do we know about lonely adults in the US? Just some basic crosstab, nothing fancy, descriptive statistics on older adults who are lonely in the US. And then I'll present some summary findings and I have some challenge questions for the audience. And this is interactive, so if you ever want to jump in with a question or comment, I welcome it in this presentation. So what are the social determinants of health? This is the World Health Organization's definition, that the social determinants of health are the conditions in which people are born, grow, live, work, and age. They're shaped by the distribution of money and power resources, and they are mostly responsible for health inequities, right? So we have these health inequities, and the causes of these inequities are the social determinants of health. So Healthy People 2020, which is a major research project, came out. They said there are about 5 major domains of the social determinants of health. The first being economic stability, education, health and healthcare, neighborhood and built environment, and social and community context. So you can see how this all connects really closely to what you guys are doing here with the Smart and Connected Cities project. So to review economic factors, right? So we know that poverty is a major determinant of health. So you can think about this is percent of adults with chronic disease by their income level. You can see that steep gradation. In a world where there would be no social determinants, right? They would have equal, the bar graphs would all be equal, okay? So these disparities are really at the root of what we're talking about when we talk about the social determinants of health. Economic factors matter. Educational factors matter, right? So adults with less than high school degree have shorter life expectancies than adults who graduated college. I tell my students, you will probably live longer. You know, education matters, and it's an important determinant of health. Race also matters, right? If we look even within the education domain, we see differences across different racial and ethnic groups in terms of life expectancy. This is actually a percent of adults who report fair or poor health. And you can see that there are differences within the educational and even within that across the racial and ethnic groups. Health and healthcare matter. This is my favorite graph here. It might be hard to see, but the U.S. We spend a lot of money on per capita healthcare, and this is the life expectancy the U.S. So we're not really getting a good bang for our buck in terms of healthcare, right? So it's akin to paying $10 for a slice of pizza when your neighbor pays about $5 and gets a bigger slice with vegetables. Okay, so that's our healthcare nature, our healthcare system in a nutshell. I think it's a bit of a tangent, but I think longevity and healthcare matters. Healthcare access matters for longevity, and the quality and the accessibility of healthcare really matters. We know that neighborhoods really matter. Neighborhoods in the built environment matter a lot. So everything you're doing, whether transportation, building more connected communities, really matters. So living in neighborhoods with high rates of crime, of course, can cause stress and be detrimental to health. There's really robust literature on these neighborhood factors. The built environment matters, zoning matters, transportation matters, access to open spaces, to parks matters, grocery stores, where you work, health clinics, these all matter in terms of your health and well-being and for older adults. So these are the kinds of things that you really want to promote with your technology, if technology is the approach to doing it, right? And of course, I think social and community context matters. So we know that social capital, right, the strength of your social relationships is really important, right? So social cohesion, loneliness, limited involvement in the life of the community, discrimination, exclusion, these are all important factors impacting your health. So have a huge impact on your health. So social capital can provide individuals with access to social support, to linkages, and resources. If you feel positive about your community, it can be health enhancing. These are things we really know. And so I think loneliness really fits within this final factor here, which is the social and community context, right? Loneliness, which can be viewed as a determinant of health, right? This is not usually framed in this way, but I think you can really view it as a social community factor that's determining health. And what is loneliness? Okay, so loneliness is subjective social isolation. It's sometimes described as the difference between what you want in your social life and what you don't get, okay? Because some people need more socialization than others, and those people have larger gaps if they're not getting it, right? So it's a subjective experience, right? So it's not necessarily the amount of interaction you're having, it's how isolated you are and how subjectively you feel that you're lonely, right? So there is great research now on the health effects of loneliness. That those who are lonely are at risk for negative health outcomes, including increased depression, chronic health conditions, early mortality. So this is a result from a recent meta-analysis that just came out showing that when controlling for lots of statistical confounders, that social isolation, loneliness, living alone, increases your likelihood of mortality by 29%, 26%, and 32%, right? So loneliness is more predictive of early mortality than smoking in some circumstances. Really interesting biological, biochemical effects that are being studied now and throughout university campuses in many different departments and many different disciplines. And you might have heard of this because it's in the news a lot now, right? Loneliness is making its way into the news. This is probably not news for you, but especially in the UK, they just announced a new minister for loneliness as part of the UK government, right? A cabinet level position in the Prime Minister's office. So Europe and Britain are definitely very much attuned to the real health effects of loneliness and the implications of loneliness. The former Surgeon General under the Obama administration cited the loneliness epidemic as the largest concern he had about the US going further. There are a lot of reasons to be concerned about loneliness, and if we're interested in applying technological solutions, I argue, let's focus on reducing loneliness, because I think it's a really important problem that's underappreciated in our current climate. So what do we know about lonely adults in the US? I said I was an empiricist, so what do we know about them? If we're gonna solve this problem, we need to think about who they are, what their characteristics are, what may be some risk factors, what are some protective factors. So here, what I've done is I've just gone into the Health and Retirement Study, which is really the gold standard aging survey funded by the National Institute of Aging. They had this special module called the Leave Behind Questionnaire, where they asked a small select group of survey participants about loneliness. And I used what's called the UCLA Loneliness Index, which is a 3-question index about do you feel excluded, do you lack companionship, do you feel isolated? And those 3 questions are summarized and made into what's a loneliness index, and I just dichotomized it to call people lonely or not lonely. So here you are, the first to see these results on what we know about lonely people. So this was a very interesting result about lonely people in the US. So and people in their 70s are less lonely than the other age groups. I don't know if people want to surmise why, but we can see here that lonely adults, so 9% of adults in their 70s, this is a nationally representative sample of older adults in the US. I should repeat, nationally representative sample. So 9% of older adults in their 70s are reported being lonely, where in their 90s, 23% of older adults in their 90s are reporting loneliness or on this categorized criteria. So that's, if you're going to focus your attention on loneliness, it seems like the 90s is a good place to start. Really high rates of loneliness. Interesting, in the also very high, so people are in their 50s. Maybe it's people go on vacation, maybe they can do vacations and retired, they're living their glory years in their 70s, and they're connecting with grandchildren. I don't know, I really can't explain this. here, but I think an interesting finding around age discrepancies. We see that lonely adults by years of education, so adults who have fewer years of education, so less than 12 would be less than a high school degree, have higher rates of loneliness than adults with higher degrees of education. So there's the same education gradient to loneliness that we were seeing earlier on the other health outcomes we were looking at in terms of early mortality or self-reported poor health. So education matters in terms of loneliness and who these people are and who you want to target. Race matters, right? So black African Americans appear to be lonelier than white Caucasians and others. So 16% of older adults, 50 and older in the U.S., of African Americans are reporting loneliness, can be called lonely. That's a very high number, 16% lonely, for society. Yes?
How do you define loneliness?
I talked about it earlier. Let me go back. Yeah, so there's a UCLA loneliness index where you take 3 questions and they say, how often are you lonely? Often, never, sometimes. And you summarize that, and I dichotomized it on that scale. So 6 or higher.
That might be different for different cultures and different races, So
how the scale works? Yeah, the scale has been validated in a lot of different places. It's considered the gold standard scale. I wouldn't be shocked to see someone question its validity for different countries and different things, but in terms of loneliness research, it's been heavily researched, the psychometrics properties of it. Yeah, it's a good index. Yeah, it's a good index. So this is the short version. There's also a 20-question version of the UCLA index. This is just the 3-question. It's the only thing I had in this is all better than just asking people, are you lonely, right? Because that's the alternative. Because we have that data too, but this is better than that simple subjective question. So this is a very interesting grade. So adults who self-reported poor health are much more likely to be lonely, right? Look at this gradient. So your poor health and your loneliness are very closely connected. So if you, interesting dynamic. Adults with disabilities, this is a population that I really care about. This is my research area. We have about 12 million older adults, or 12 million people on Social Security disability benefits, and that population has been growing over time, largely due to population aging. That population is growing out of Social Security disability and moving on to Social Security and old age, right? The other old age category programs. And so, it really matters that this population is very lonely. I mean, that's actually how I first got interested in this, is I was just running some simple crosstabs in my data set, and I was like, wow, this population of people with disabilities are really lonely. And loneliness matters for their health, and if we're going to improve their health, if we're going to improve their outcomes for medical visits, for all the things we care about, we really, I think, need to think about their loneliness and their social isolation. All right, so those are some basic characteristics. Here are some community attributes about lonely adults. Adults unable to drive have higher rates of loneliness. Not surprising, but if you can't drive, it appears that you have a higher rate of loneliness, right? So it goes up with those. Inability to complete your activities of daily living also appears to be associated with loneliness, or at least you have higher reported rates of loneliness. So adults who report not being able to do one activity of daily living in their 50s, 29% of those are lonely, or are we classify as lonely. Adults who are poor have higher rates of loneliness. Poverty, just like we saw a poverty health gradient. This is also adults who are poor reporting poor health, or who are poor but who are in poverty, right? So this is a poverty measure that the HRS puts together. I think it's post-transfer income, looking at using the federal poverty line as the guideline for determining poverty. And you can see that in the 90s it doesn't seem to continue, but in the 50s there's a real discrepancy here between lonely and non-lonely older adults in poverty. So those who are in poverty, 23% are lonely in their 50s. Yes?
Yeah, with the meta-analyses, it's obvious that they're going to check the compounds, but a lot of these, you're talking about correlation. To what extent are these studies where you're pretty confident about direct causation?
Zero confidence on this. I'm not making any claims of causality. I think the bidirectionality problem is huge. I'm doing research to do, like I'm working right now on research that does loneliness predict work disability, and how do we get at the fact that disability causes loneliness, and then loneliness can cause disability. They're very complicated questions. You need path analyses. These are very much descriptive data that I reserve to you to explain, right? So I don't have the means to explain the directionality of the relationships here. I think that's structural equation modeling. That's a different battle than what I'm here for you, is just to show simple descriptive data on what we know about older adults who are lonely. So adults who volunteer have reduced rates of loneliness. So I can say with this that there is really good evidence on loneliness. There have been studies published showing an attenuation of loneliness amongst adults who volunteer. And actually, I think it depends on the degree of volunteering. You can't just volunteer once a month. You have to volunteer every week or twice a week, right? There has to be a high degree of volunteering. But volunteering is protective against loneliness, and you can see it in this data set that adults who do volunteer are less lonely, right? So volunteering could be something to try to boost, right? Religious service attendance. This is correlational. Everything is correlational, but this is very close to causal. I would argue I'd like to see it in a regression context. But here is religious service attendance and loneliness. So 1 are people who on every daily attend a religious service, and 8 are people who never attend religious service, and their rates of reported loneliness. And you can see this big jump here. So religious service attendance appears to be protective against a risk of loneliness, and I would argue that probably any sort of communal participation element, face-to-face encounters with people, are going to be really important. And any organization, any participation that adds meaning to somebody's life, maybe it's a Rotary Club, maybe it's your local Rotary Club, or local sports club, any kind of communal organizational activity, I would say I would be promoted for. And that kind of makes me partly underlies my techno-skepticism, is I think face-to-face encounters matter. I think social groups matter. I think we need to interact with each other to really get at some of these larger issues here. And I'd like to see how technology can do that and better than it has. Frequency, this is my last figure, I promise. Frequency of interaction with grandchildren might matter, it might not. I would also like to see this in regression, but it looks like that individuals who have more frequent interactions with their grandchildren will have lower rates of loneliness, right? So in creating multi-generational interactions could be an important protective factor, something that we should be aspiring for in our smart and connected cities. So here are my summary of my descriptive findings. Loneliness prevalent among older adults, highly prevalent. Those with lower education, African Americans, and among those in poor health, it's highly prevalent. Older adults who are unable to drive, unable to complete their activities of daily living, who have work disabilities, who are poor, also have higher rates of loneliness. Volunteering, attending religious services, and interacting with grandchildren may protect against loneliness. And just to conclude, loneliness is a major social welfare problem, and I think will only become greater over time as populations age. And I think there is a spike once the boomers reach past their 70s, where we could see rises in loneliness if that age factor really matters. So I think the question for me, from my perspective to the audience, is how do we create communities that protect against loneliness? Is there a positive role for technology? Because my understanding that the promise of technology, we heard about Facebook, has not been so positive for social isolation and for community networks. So I'd like to hear about what is the positive role, and how do we think about the positive role for technology, given what we've learned about in past Facebook, not necessarily transportation systems, I think those are wonderful, but in terms of social networks and online social media, I think that's probably been a negative for social relationships. And then what can be changed about the built environment, right? I think mobility is going to be huge. Like driverless cars could be huge for people with disabilities, people with mobility limitations, to get them out and about in the community in social settings, but there needs to be those social settings for those people, right? We can't just focus on mobility. We need to think about creating context, creating places for people to share, to have meaningful experiences with each other, and to promote their overall health and well-being. So I'll take your questions. Thank you.
Great presentation. Hello? Great presentation, really great data. So I was just curious, since many more older adults who are women live alone, did you find a difference between men and women in your loneliness scale?
I did. You know, I didn't do that crosstalk. I could very easily do it right now. But I know that there was a great article from from Denmark actually on this very fact around looking at older men who live alone and showing that volunteering attenuated their risk of loneliness. It was a great article from Denmark. Yeah.
Yeah, thanks for that presentation on the HRS data. Maybe I missed it or I didn't catch it. What was the cutoff you used for defining?
6. Yeah. So score. It's used a lot. I really use it. I wouldn't use it if I was using a regression, but just to present descriptive statistics. So a score of a 6. So
you had to agree to each of the items, or
it's a summation of each. So it's a scale of 1 to 3, right? So 3 each question you're asked.
So if you were on the highest category on 2 out of the 3, you'd qualify.
Yep. If it came up to 6, right? So 9 would be the highest score, right?
Okay. So. And then just another quick comment.
Yeah.
I could call myself a techno-realist, but I'm part of the Center for Research and Education on Aging and Technology Enhancement, and we published fairly recently looking at a carefully designed, mainly computer system for trying to combat loneliness and social isolation in older adults. It's published in Gerontologist. And we had some success, modest success, I would say, good effects in terms of improving social. We were looking at not just loneliness, social isolation, but social connectivity measures as well. So we had quite a broad range of outcome measures. This was a clinical field trial. And we had reasonable results at 6 months. They kind of dissipated again a little bit later. So at least there is one reasonably strong result from a clinical trial indicating that technology can influence, can alleviate some aspects of social isolation.
Yeah, no, I would totally, I'm a big proponent of anything we can do, but will it really turn the needle on the aggregate loneliness scores? I'd be skeptical. You know, it's almost like we want to go back to the 1950s in terms of socialization, right? Where people were not bowling alone, right? Where there was that community. We want to bring back those kind of communal cultures. I think that's the key ingredient from my perspective. Yeah.
So a comment about technology.
Yeah.
So I think one of the issues is we lump technology together, and there's a difference between asynchronous and synchronous involvement. Think about MOOCs, right? And how students are not participating because there's no involvement because it's all asynchronous. You go online, you do it at your own pace, you're not part of the group. I'll introduce someone because this gentleman, David Dring, is from Self-Help. They have a virtual senior center, which is synchronous. People come on as a college. You have to see the people that are on. They're in their 90s, and in 90s, people don't have friends anymore because most of their friends have passed away, or they can't get out of the house. So they're on the phone, but they can't see them. So if you go to something that's synchronous and you're seeing people and you're interacting, you're bringing it into the house where otherwise they might not be able to do it. Do you want to say something?
I think you did a great job.
I'm a daily FaceTimer with my family. I totally believe that there are positives to those interactions, and I would not dispute it one bit. I'm still a social movement type person. I would like to see more social organization. But they don't have to be dichotomous. They don't have to be either or.
I think this whole concept of technology and thinking of it as asynchronous, because like Facebook, you know, there is no interaction.
Or no positive interaction.
Yeah.
Maybe some. Birthdays, yeah. Any other questions?
No questions. Thank you so much.